The worsening outbreak in Indonesia has led to an oxygen crisis. Hospitals there are running out of supplies, with one medical centre reporting more than 60 deaths due to shortages. Saiful Bahri Ismail with this report.
An extraordinary sight in Jakarta. Residents waiting hours to refill their oxygen tanks at this supplier in South Jakarta. As a severe wave of COVID-19 hits Indonesia, the country finds itself in the grip of an oxygen crisis. Medical oxygen is now in hot demand. It's a much-needed commodity for COVID-19 patients with breathing difficulties who have been warded in hospitals or are isolating themselves at home. This factory in East Jakarta has seen a demand for oxygen refills go up by as much as 300% as desperate residents hunt down supplies to help keep their loved ones alive.
Untuk mencari pasokan oksigen yang memang udah berkurang ya di Jakarta ini memang agak susah sekali, dan kebetulan memang kemarin saya sendiri mengalami untuk keperluan Bapak yang sekarang di rumah sakit. Dari pihak rumah sakit juga memang sudah memberitahu kalau untuk pasokan oksigen di rumah sakit mereka sendiri ketersediaannya memang terbatas. Diperlukan untuk yang memang urgent banget, dan yang sekarang disarankan dari rumah sakit, untuk mereka bisa menerima, tapi untuk pasokan oksigen bisa disuplai dari keluarga pasien masing-masing.
The factory says it will not be hiking prices despite the surge in demand. Here, the cost of oxygen for a 1 cubic meter tube is about $2. A larger 6 cubic meter tube will cost just slightly more. This factory is able to refill 60 oxygen tubes in 1 hour. This particular tube has a volume of 6 cubic meters, and the oxygen in this tube can last for about 24 hours if used non-stop. This oxygen supplier is giving priority to hospitals and those with urgent medical needs. To prevent hoarding, it is also limiting the number of tubes for refills. The factory says it has enough oxygen to fulfill growing demand. What it's concerned about is the shortage of tubes.
Kalau liquidnya kita sampai saat ini cukup untuk cairannya, maksudnya. Jadi yang jadi masalah ini orang tidak punya tabungnya. Kalau gas cukup kita sampai saat ini masih bisa mengcover. Kalau tabung tidak sudah kosong sama sekali, kita tidak bisa jual tabung karena memang sudah kosong dari punya kita. Bukan kita aja yang kosong tabung, di mana-mana memang tabung langka. Kalau tabung kita dari Cina ya, karena corona ini jadi pasokannya agak lambat lah.
The government has stepped up efforts across the country this week to deal with the oxygen shortage, after deaths due to a lack of oxygen supplies running out were reported at some hospitals. It has set up an oxygen task force in each province and has instructed oxygen producers to allocate 100% of their production to medical oxygen. Authorities are also importing supplies of oxygen.
Sedangkan yang ringan itu kita akan gunakan apa yang disebut oksigen konsentrator. Oksigen konsentrator ini mengambil dari udara biasa, diproses dan bisa dihirup. Itu sekarang sudah ada kita pesan 10.000, dan sebagian sudah mulai kita datang pakai pesawat Hercules dari Singapura, dan juga kita akan ambil dari tempat lain bila kita rasakan masih ada kekurangan.
The International Federation of Red Cross and Red Crescent Societies has declared Indonesia on the brink of a COVID-19 catastrophe. As hospitals already stretched to their limits gasp for air, the government is bracing itself for a worst-case scenario and is working towards stocking up enough medicine and oxygen should the number of daily COVID-19 cases cross 50,000. It hopes that scenario will never come to pass and is pressing ahead with a partial lockdown and vaccination efforts in a bid to turn the COVID-19 tide. Saiful Bahri Ismail, CNA, Jakarta.